Good day, everyone, and welcome to Black Health Trust. I am Dr. Ivan Walks, and on behalf of our founder, Dr. Randall Maxey, our co-moderators, Dr. Nabrit Stevens, and Dr. Hines, I'd like to welcome you all to Black Health Trust. We have a lot of really tremendous things going on. Dr. Maxey is going to be able to join us, I think. He is receiving a Lifetime Achievement Award at the National Medical Association. And so we are very excited about that. Today, we're also excited about a program we're going to be able to share with you. Health and wellness for seniors. Now, it may sound like this is a program just for seniors, but so many of us are impacted by the health of folks who are a little seasoned like myself and others. Many younger people are in the business of taking care of folks who are not as young. And so with that, it's important for those of us who have an impact on seniors and are able to talk with seniors to be able to help seniors with the maintenance of our bodies and our minds. So I'm going to ask Simon to please cue up our presentation today. It's one that we have had before, and sometimes if things are really important, you got to repeat them. So we do that from time to time on Black Health Trust. So I would like to ask Simon to go ahead and run the video for us, and then we'll have conversation after.
Go ahead go show her. I want to see her picture. And then you can go to her slides after that.
Thank you, and I'll start there. So I always put this character on the screen. I don't know if you guys are seeing, it should be a picture of a cartoon character, Buzz Lightyear from the Toy Story franchise.
Yes.
You may see the picture soon, but for any of you that had kids or grandkids or just felt like a kid, in the past couple of decades, maybe you have seen some of the Toy Story movies. And this character was the ever optimistic, looking on the bright side superhero Buzz Lightyear. And his catchphrase, that he would say over and over again is to infinity and beyond. And I use that quite often in my own practice when I'm dealing with my patients, in particular my seniors, and they want to, ask, well, how long am I going to be around, doc, or how healthy can you make me? And I want to inspire in them that I want them to be around to infinity and beyond. Next slide. And that's just a picture of me. We can go on to the next slide. Okay. Now, also for some of you that are older than 10 years old, you may recognize this gentleman, Mr. Dick, the late Dick Clark. And I put his picture up here because I grew up every year, and I still do, it's sort of almost in honor of him, and watching the ball drop on New Year's Eve. But New Year's Eve was synonymous with watching the Dick Clark Rockin' Eve show. And one of the things my family and most people I know always reveled over was, my gosh, does this guy ever age? I mean, he went from American Bandstand and New Year, just year after year after year after year, he seemed to have the vigor and the spirit and even the looks that just just were timeless and ageless. So I always think of Mr. Dick Clark, and and he was doing this probably without some of the augmentation options that we have today. We're going to the next slide. So how do we do this in the new millennium? Well, let's talk a little bit about aging in the 21st century. And this is a wonderfully dynamic time and period for medicine, for what we call aesthetics or integrative or regenerative, or, all of these things coalesce at this period in time in a wonderfully magical and symbiotic way. So let's go on to the next slide. Okay, so let's start off with when we're talking to patients or clients, depending on how you like to refer to the individual or yourself, we talk about that nowadays there's a healthcare team. Once upon a time, there used to be an old show, Dr. Marcus Welby, where he was kind of the doctor and he told the patient what to do, and the patient listened yes or no, and and it was sort of this paternalistic relationship. These days, the patient or the client and their provider are all part of a healthcare team. And that team, of course, has the captain, which, if it's pertaining to you, the patient, that is you. You're in charge. You're in charge of your destiny. You're in charge of the options that are available to you and whether you utilize them or not. But you are an integral part of that team, and your participation is vital. Now, it gets very confusing in these days because with HMOs and managed care and different types of insurance and covered California and gosh knows the on and on myriad descriptions of how we attain our health care, it gets confusing. Well, what are the roles of all these different persons? So we already identified that the patient is the captain. That's the person that is in charge. And I recommend, of course, I may be a little bit biased being a primary care physician, which is abbreviated PCP, but I think we're also an important part of that team too. Not as important as the patient, but pretty important, so I'll call us the quarterback, okay? So now, a lot of people sometimes, even in my own family, sort of try to bypass the quarterback position because they feel like, well, that's just one extra person I got to go to. I can call my cardiologist, I can call my, my heart surgeon and stuff. But it's important to have a person that's kind of the owner or the one that can kind of encapsulate all of these different things for you, that can help these things interconnect, because your specialists, well, they're very busy and they're also looking at things many times from their point of view as opposed to the holistic point of view. So having a primary care physician, which is what we are called these days, not to be confused with once upon a time people might have said, oh, I have my general practitioner or my GP, is typically something that you want to have as part of your team and that you, the captain, want to have a close relationship with. Now, the other key players on your team, those are all the persons, if this is a game, whatever your sport is, that is important in helping you reach that goal. So that may be other specialists, that may be your family, that may be your neighbor, that may be your pharmacist. There's an infinite number of persons that can be part of your team at any given period of time. Next slide. Okay, so I believe we also have on the call a wonderful Dr. Jesse Sherrod, and many years ago I felt like we pioneered, touting this to the public, letting them know this catchphrase, know your numbers. Okay, and what does that mean? That means that as part of your healthcare team, unfortunately or fortunately, there comes a little bit of responsibility. So some of the things that a patient, any person, if within their wherewithal, should try to know and remember are, at the very minimum, these three things. Something called your BMI, which is your basic or basal metabolic index. And that's a calculation that sort of plugs in your height and your weight and gives us a number by which your medical providers can communicate, the status of your weight as healthy or unhealthy, obese, overweight, or non-obese in an objective manner. So it's not about how good we think you look, or we think you look chubby, or we think you look skinny. We can all talk in terms of BMI and know that we're talking about the same things. Now, the next thing is your hemoglobin A1C. You may see it on commercials, or, it's important to just remember the last three parts, which is A1C. Do you know your A1C? That first word, hemoglobin, is not to be confused with hemoglobin as in your blood count. The hemoglobin A1C is what pertains to your blood sugar, and it is a more accurate description of whether or not a person actually has diabetes or is pre-diabetic than checking your blood sugar or your glucose at any one moment in time. Your hemoglobin A1C is reflective of the average of your glucose over 3 months. So you can't cheat before you go to the doctor. You can't eat a salad the day before and say I have good numbers, or you can't blame it on the donut you ate night before last. The hemoglobin A1C really lets us know the truth about how your blood sugars are doing in your body. And just so that you know, we want your hemoglobin A1C to be less than 5.7. Okay. And then your cholesterol. Now, cholesterol can be a little bit tricky because there's several values that are reported in cholesterol. And depending on the doctor that you're going to, they may check certain types of panels that list some or all or different aspects of the cholesterol. So it can be sometimes challenging to communicate your cholesterol from person to person. But at the very least, you might want to know what your total cholesterol is, what your LDL, low density lipoprotein, also known as your bad cholesterol, and something called your cholesterol ratio. Now, a question patients may ask me is, well, what is bad cholesterol? And unfortunately, I like to say, well, you know it when you have it because it's delicious, right? So if it's yummy, if it's oily, if it's making you go, that's so delicious, like those fries and that pizza and that ice cream, yeah, that's probably the bad cholesterol. So you don't have to think too hard about it because it's usually putting a smile on your face. All right. So we just want to make sure that we know those numbers so that we can always be cognizant of how to modify and optimize those numbers. And just so for the record, we want your total cholesterol to be approximately less than 200 in most persons. We want your LDL to be approximately less than 100 in most persons. And cholesterol ratio, there's a couple of different types, and it's specific to your sex and your age. So that may vary depending from person to person, but usually 3.2 is a good number, is a good basic number. Okay, next slide, please. All righty. Still talking about this captain, this member of the healthcare team, some of the other responsibilities that would go very far for you, whether we like it or not. And that is, you still want to get those regular annual examinations. Everyone goes to Google and we can look up how we feel. And believe it or not, I go to Google myself, but nothing is going to replace you, the captain, meeting with your doctors, particularly your primary care doctor, at least once a year. And when you go, us doctors would love, love, love if you know what medications you're taking. So you can bring in a list of your medications, or what I even like in my office is, hey, just throw them all in a bag, just go to your medicine cabinet and just for that one day, throw them all in a grocery bag and bring them in so that I can go over them with you and we can make sure that what you're taking is reflective of what's in the charts. Many times patients will come in and say, hey, doc, it's in the chart, you got it. But guess what? You've gone to other doctors in the emergency room and this or that, or grandma forgot to put something down 3 years ago and the nice little medical assistant says, hey, is it all the same? And some misinformation gets transferred visit after visit after visit. So at least on that annual exam, bring in the medications so that, you know, what you are taking is actually what is reflected and can be addressed. Now, some of you who have been to the doctors in the past few years may have heard terminologies like, hey, but it's on my chart. You know, I saw my sister's my chart. Well, my chart is a product that a lot of large hospital systems and even some doctors use as your medical portal. If you have access to a my chart, I highly encourage, once again, like it or not, that you get familiar with it, because these days that is becoming more the trend of how to store and communicate your medical records. And they really are now putting that onus more on the patient than on doctor to doctor as it was previously. And lots of things will be coming to you from your my chart or from your doctor or from their staff via email or text messaging. So we do have to get familiar with some of these more modern our help, considerations. Next slide. Okay, so let's talk about where we've been and where we are now. I always like to point out that things are improving. Like sometimes it seems like from day to day, year to year, voting cycle to voting cycle, are things really even changing? And I put up some data here from 1970 to 2020 just to show you that, our life expectancy, these are the reported life expectancies for those years, have changed. If you see there on the left, it shows that back in 1970, doesn't seem like that long ago, maybe for some of us, uh, the average expectancy of life of a black man was only 60 years old. These days, a 60-year-old black man just seems like a kid, right? Like if someone passed away at 60 years old, you say, "Oh my God, they left here too soon," And to see now in 2020 that the life expectancy for black men is 72 years old. And I would like to put an asterisk by that to also say that, that data is probably even outdated, is probably even higher today. And you're also going to see higher numbers in the communities that are probably more affluent, more educated, in those expectancies being even higher. But nonetheless, we have improved in our life expectancy. It's wonderful to see that even in 2020, women, our average life expectancy has now exceeded 80 years old. And that's the average, and what I see in my own practice is much, much higher than even these numbers. Next slide. Okay, and well, let's talk about what makes us go away sooner than we want to go away. Well, in all cases, men, women, all races, black, we see that heart disease and cancer are topping the list that, what people pass away from the most. So that goes back to like knowing those cholesterol numbers, knowing that hemoglobin A1C. These are some of your predominant risk factors for heart disease. And then cancer, certainly we want to try to prevent cancer as best as we can, and we want to detect cancer as early as we can. Next slide. So when we talk about detecting cancer, and this is us going to see our doctor once a year in case we don't want to remember all of this stuff ourselves, that's what you pay us for, is that we want to start getting our screenings. And these are just some highlights of some of the more updated screening recommendations. So for breast cancer, I hope all of us women, especially black women, are starting to get their mammograms by no later than age 40. And that is every year. Okay, and where it says stop there at age 65, I would put an asterisk by that because if you really look at the details of most data, that's also based off a discussion with you and your doctor. Because if you're thriving at age 75, in my own practice, I continue those breast cancer screenings to longer than that age, depending on how well the person is doing overall. Similarly, alert, alert, alert. Colon cancer screening starts at age 45. So all of you that last week thought it was 50, nope, it's age 45. So if you were waiting around to get to be 50, you're already 5 years too late. And for prostate cancer, you want to start at age 40, especially in the black male community. Many of you may have heard that this guy we once heard of named O.J. Simpson just passed away a few days ago, and he passed away from prostate cancer. And that's just one example of how prevalent and predominant prostate cancer is in the black male community. There's some new changes with cervical cancer screening. Now it starts at age 25, so that's a bit later than we thought it was previously. So those of you still working on like 21 or 18, that's outdated. Now we don't have to start our cervical cancer screening until age 25. And we actually can stop that earlier. We can stop that at 65. Lung cancer, we don't screen everyone for lung cancer. We do, however, recommend screenings for our smokers. Next slide. So those are ways we can stay healthy from the inside. Now let's talk a little bit about ways we want to feel good from the outside. Next slide. Many of us, I hope, recognize this wonderfully gorgeous, spirited and looking young lady, especially some of our male viewers. Her name is Miss Halle Berry. And I wrote the word still because she was once upon a time synonymous with beauty, not just in the black community, but in the world over. And she still is. Next slide. This slide here, you will see it's a slide with a lot of different pictures. I don't expect you to zoom in and look at all of those different pictures that'll be coming up shortly that says Zoom Boomers. And if you aren't seeing that, it's just to let you know that right now there's a trend going on called Zoom boomers. And what that means is that in the past few years with the COVID pandemic, the world has shifted as we are doing today, where we're doing a lot of things via Zoom as opposed to in person. But people are now on Zoom recognizing that when their close-ups are zoomed in, that they have blemishes or that they don't look as spry as they would like to have looked and stuff. So people, when they get off their Zoom camera, are running into their doctor's offices and other places to say, hey, you need to make me look a little bit better by the time I do that next Zoom call. Okay, so this is a whole phenom that everyone is trying to look better because of the Zoom effect, because we are recognizing, it's like looking in the mirror, but looking in the mirror in a public setting. Go ahead to the next slide. Okay. And just to, this value, if you see the slide here, I wrote the money spent on treatments to look younger. Now, we can play with this statistic in many different ways. And if you see here, I have written 10 billion, but that is a very, very small estimate of really what this market is. This market is actually in the triple digits of billions in terms of what is spent on skin treatment. So depending on how you couch the search, but 10 billion is on the shy end. And just to go into that a little bit more deeply, how much are people spending on trying to look younger? Well, even just to put in $500 a year, you see back in 2000, 20% of people, over 50, that's quite a large number. That's one fifth of persons over 50 were already spending over $500 a year, on things to make themselves look younger. And now in 2022, you see that number is approaching 50% of people are spending over $500 a year. Now, people fuss and grumble at my medical practice because of the parking. That they may pay $10 to $15 to come for their medical appointments, which may be to discuss their heart or their cancer or any other number of things to help them stay healthy or alive. But we are spending over $500 a year on ways to look younger if we want to kind of, gauge where person's mindsets are. But that's not exactly unwarranted, because feeling good on the outside does have positive benefits in how we feel overall. Let's go ahead to the next slide. Okay. So as I just mentioned, when we look good, we do feel good, and there's been data over and over for over the years that when people get their smiles fixed with their dentist and stuff, that they start to feel more confident and they start to become more social, and those social interactions bring them, it helps raise the endorphins. It just helps improve their overall health. So something as simple as fixing your smile actually makes you healthier, and that can be extrapolated upon in many, many different ways. And certainly we know that exercise is good for our health. Exercise is good for our heart. Exercise reduces the all-cause mortality. Exercise reduces the risk of cancer. But exercise makes us look good too. So, regular exercise, is also good for helping us to age well, both inside and outside. And, I don't know what type of audience, hopefully it's not a G audience that we're talking to mostly, but, I was going to put up a slide of a young lady that's no longer with us, also named Suzanne Summers. And, Suzanne Summers was famous for the show Three's Company, but, she also was a workout queen and had videos on exercise and stuff. But as she got older, she publicly said that the true key to good health was to have sex, and that she made a point of having sex every day for her health. So I don't know if any of us can keep up to that standard. But, regular sexual health is definitely recommended as well. And say this to patients in my practice, and some patients will say, well, I'm single, I'm not in a relationship. And once again, I don't know the audience we're talking to, but sex does not have to be with another person. So, we can also, enjoy sexual relations with ourselves, but there's also this thing, if you don't use it, you lose it. Well, that is true, because we have certain hormones in our bodies and stuff that are only excreted during the experience of sexual pleasure, and those things actually have positive physical, impacts on our overall health. Um, Down here, it is Sunday, and we talk about fellowship. Fellowship could be in the form of religion, it can be in the form of hanging out, it can be in the form of calling a friend, a neighbor, but having relationships with other persons. And it's important to highlight this at this time, because we are living in an age where, with the pandemic and Zoom and social media and stuff, that we forget to have human to human contact and interactions and stuff. And it's important to try to reincorporate, if we have not been, or to continue to incorporate, those types of experiences for us, because those things help keep us healthy as well as keep us young. And then we'll talk more about, how we can do some things, some fun, cool things to, augment the aging process by working on our skin and our body, such as skin care and body contouring. If you haven't started hearing these terms float around in your, circles that you run in. Next slide. Okay. So I put some names in here. My son's gonna kill me, but here, this slide is kind of busy, but it talks about skin. So one of the first things, with our skin, and once again, if we looked at the numbers of what people spend on skin products, the numbers are in the triple digits in terms of billions. But a basic good skincare routine with cleaning your skin and moisturizing your skin. I'm sexist, I admit, but sometimes I have to remind my male folk that using a daily moisturizer is actually not just good for how they look and how their skin feels, but it makes it more resilient as well. And I put up your example, Gage and Jacob. This is my son and friend's grandson, and they're two teenage boys. One's on a basketball team and one's on a football team. And I'm talking to a friend, and she's telling me the story about how she's fussing at her grandson, Gage, a high school football player, to take out the trash, and he was not. He's a teenage boy. So she goes into his room to expect he's in there on his video game, and no, turned out he was in there with his face mask, saying that he was working on his on his facial routine, and that he'd get to the trash when he was done. And my son Jacob just got his own little bank account card or something, and the first thing I see purchased in the mail that he's purchased for himself is some things to prevent wrinkles in his eyes, so that when he gets his new contacts, he won't have dark circles under his eyes. So, we joke, but this trend of wanting to look healthy and stay young has expanded into every arena that we can imagine. And including our washing and our moisturizer, we want to remember sunscreen SPF 50 or greater. And I like to remind our persons of color that includes us too, because we sometimes don't use sunscreen if we don't feel sunburn, so we don't think we need it, but we are still susceptible to the negative impacts of UV rays. So even if we're darker skinned, we may not feel sunburn, we too should be using a daily sunscreen. My next line down there, I have the poor plastic surgeons. And what I mean by that is that, in this day and age, people are acquiring treatments for their skin and their wrinkles all over the place. So now you don't necessarily have to run to the plastic surgeon to have facelift, right? You can get treatments in a variety of different medical settings. I get my face treatment stuff at my ophthalmologist. Believe it or not, a lot of the gynecologists are in the skin game. So you go for your pap and you get your face tuned up while you're there too. So you do see a lot of opportunities to, to work on your appearance in a myriad of different settings that don't have to be necessarily at the high price point of, surgical procedures with our plastic surgeons. Uh, and some of those treatments include, things like PRP, which has been around for some time. PRP stands for platelet rich plasma. So that's where we take your own blood and its healing and regenerative factors and we put it back into your own body in a variety of different treatment ways to help. But wrinkles is just one of those things. And most persons have heard of Botox. Botox is like saying Xerox. It's the most common brand of neurotoxin, but there are competitors to Botox injections as well. And fillers, people want their lips plumped up or want some sunken, cheeks filled out. So that too is has been being used widespread and is becoming more and more commonplace across the races and the ages and the sexes. Microneedling has been around for some time and it can be used alone or in combination with your blood, like the PRP, in combination with laser devices such as radio frequency that I have listed there. And I don't know if that link will come out if you copied it, but it was an article just giving you more detail on what radio frequency or RF is. But I can also, if time permits, talk to you a little bit about it. But I'll group radio frequency kind of in the category of laser treatments. And these laser or radio frequency treatments, as I mentioned previously, are available very widespread now, and not just at some of your higher end specialist office, but I offer them at my own office, and so do several of my colleagues across the city. And the good thing is that, these are not cookie cutter approaches. People can mix it up based off of how soon they want to expect results, what they want to expect exactly, the downtime, etc. So it really can be tailored to an individual's desire and need. Next slide. And as well as your skin in your body, some of us want to, also look good from the from the neck down. And I put up here, fake it till you make it. So we've been doing that since the beginning of time, right? So even as far back as the in the Renaissance and the royal days, ladies were wearing corsets, and in the early 1900s and 20th century, women, became popularized wearing girdles. You ask my kids now what a girdle is, they'll have no idea what I'm talking about. But in the in the new millennium, the latter part of the 20th century, women tossed their girdles and they started wearing Spanx. And these days, it's not just Spanx for women, but there's Spanx for women and men. Next slide. But these days, people are even ditching external garments altogether because they want to wear their swimsuits and they want to be out and about, and they're doing these body contouring treatments. So some of these treatments can be done in conjunction, once again, as I mentioned, with like PRP or alone. You may have heard of like Cool Sculpt, which uses a very cold temperature to augment the fat or the muscles, but they could do it with warm temperatures. There's things that target at the skin layer or at the fat layer or at the muscle layer or at maybe different combinations depending on which device or devices you're using. And these are typically laser or radio frequency type devices. Next slide. And just, quickly, just to note that these bodies, what's beneficial about these new body sculpting treatments is that there's no downtime, and you can go in, you can have a treatment done, for lunch, and you can go back home, and or go out to dinner that night and not have to, escape from people for days or weeks at a time as you recover. Next slide. Once again, you can mix things up. Radio frequency, it may sound scary to some persons, but it is one of my favorite things that has come about. And for the doctors on the call, I'm really excited because I've had my radio frequency device now about 5 years for the purpose of aesthetic treatments. But as I continue to go to more and more lectures and conferences, we're really realizing the utility of radio frequency, not just in the aesthetic realm, but also in the medical treatment realm. So now we're able to treat back pain and some eye injuries and some of these other things simultaneously or with the same devices using radio frequency. And radio frequency is wonderful because it's very user friendly. The device that I use in my office, Temp Sure, is highly, the device itself cannot allow you to burn people or to overtreat people, and it is using the person's own body, because what it does is stimulating, their collagen and elastin to produce in their own body without giving them something external. So I really love radio frequency and all the different modalities and opportunities we can use with those types of devices. Next slide. Okay. And this is too busy for you to read, but it just basically says, how do you know which device is best for you? Everybody kind of, once again, goes to Google, and and there's a lot of different ones out there. There's different new ones that come out every day. If you talk to your provider or whomever you're looking to have do this for you, make sure that, you get a good sense that there's someone that you can trust that is not just telling you what they offer, but also telling you what technology is out there that's available in what combination of things. And as I mentioned, the things you want to look at is, well, how much does it cost, or how long am I going to be down, or how often do I have to do it, or how fast is this going to work? And beware if people are trying to sell you pie in the sky. If you're morbidly obese, a radio frequency device for fat treatment is not going to be effective in giving you the same thing as a actual liposuction or actual surgical weight loss. So there are instances where we have to be realistic in our expectations about what we want from these different treatments. Next slide. This is once again just some of the common names of some of the ones that you'll see out there. I have Temp Sure. There's one called, I guess, Picture. One for the muscle that's very popular is InSculpt, for folks looking at what is a muscle laser device does. Well, one treatment is like doing 20,000 crunches. So anyone let me know, call me the last time you've done 20,000 crunches in one setting, and I'd love to meet you. But but that's what you're buying, is the ability to do 20,000 crunches in 1 hour from a device that is relatively safe. Or not relatively it is safe. Actually, I've tried it in conferences myself. It's pretty cool. Next slide. And this is just some attestments from the doctors that do these things. Next slide. This sounds scary. We'd love to talk about this Halloween vampire facials. Kim Kardashian, if any of you have ever heard of her, was popularized some years ago, being on TV, getting her vampire facial. And that's where we take the PRP blood from your body and we put it back onto your face, and then we do the micro needling. So, that's why it's the vampires from blood, and then but at the end of it you come out with a rich glow, a rejuvenated skin surface, reduced wrinkles. And not only is it good at the moment that you're doing it, but it's the gift that keeps on giving. So over the next 2 to 6 weeks, your skin just gets better and better and better. So, in case you've ever heard of what a vampire facial is, and those things you could find around, like I do them in my office, but they're pretty fun and cool to see what your own body can do for itself. Next slide. Every day there's something new. I love this new addition that we can do now. It's called a PRP butt lift. I had a young lady a couple of months ago that was flying to Florida to get the Brazilian butt lift, and she was explaining to me how she paid the airline to help her fly back on her knees and have her butt in the air, and all these types of things to get a butt lift surgically. Well, a PRP butt lift is where we inject your blood obtained from a PRP into target areas that we want to kind of lift and kind of mold for you. And then we can use our radio frequency device to help stimulate your elastin and collagen in those areas. And you don't even have to fly to Florida to get that done. Next slide. Okay. Mona Lisa, I'm just naming out a few things in case that you've heard of these in like common talk of, in your social circles. Mona Lisa is a type of laser treatment that ladies can get to restore their vaginal tissue, and some women are doing this for cosmetic reasons. Some women are doing it for incontinence. Some women are doing it to restore sexual pleasure. Some people are doing it to, decrease a condition called atrophic vaginosis. So it has both medical and cosmetic benefits, many medical ones that are quite beneficial. So a lot of ladies suffer in silence with these conditions because they don't think there's anything that can be done to help them. And now we know there are. Mona Lisa is just one example. Next slide. There are cool new options for doing like in-office liposuction. You can have fat taken out of one part of your body and put it in other parts. You could have it taken out of your butt and put in your lips, and you can do a lot of these things in 1 or 2 office sessions. That's not actually surgery. So if you're interested in those types of things, they are out there as well. Next slide. And pellets have been around for some time. A lot of my colleagues here in the area have been doing pellets for women, and that's where they take some of the vital sex hormones like testosterone, estrogen, and progesterone in both women and men, because women do have a need for some testosterone as well. And they put it in a little pellet, sort of like a piece of hamster food, or it looks like a piece of hamster food, and they implant it just under the skin there, and it slowly absorbs over time to provide those therapies for you. I was very happy to see the past year or two that now they've expanded pellets to be used more widespread in men as well. So I have men colleagues and men patients and stuff that are also getting pellet therapies, and it helps them, feel overall more healthful. It helps their sex drive, it helps their muscle tone, it helps their memory, it helps their sleep. So these things are not limited to just, in persons like, well, my sex drive is great, I don't need those things, but it really helps from a very holistic standpoint of view. Next slide. A thread lift, I'm just like I said, rather not new things that you may have heard of, but thread lift is pretty cool. It looks like where you take fishing wire and they thread it in parts of your jaw or your lip, and what it does is it creates it makes the body think there's trauma there, so it actually helps to build up those areas. So you can if you wanted a more square jaw, it can do that within several weeks, or if you wanted your lips to look a little bit more pouty for it to vent, it can do that too. And the thread dissolves on its own, and very little or no complications have been reported with these types of treatments. So very good alternative to getting a surgical facelift. Next slide. And so I did a lot of talking. I do thank you and appreciate you. This is my information. I'm Dr. Adrienne Burroughs, and this is my website and my office number and email. And I wanted to just kind of give an opportunity to really have more of an interactive discussion with any persons that have any questions or would like to talk more.
Dr. Burroughs, this was absolutely great, fascinating. And I'm glad I don't have to
take it down, Simon. Thank you so
You're
much,
right.
Simon. And Dr. Maxey, the highly esteemed and honored Dr. Maxey, has been able to join us. So I'd like to just thank everyone and thank Dr. Burroughs for a lot of really good information. Dr. Maxey, have you been able to come down from all that honoring that people were doing to you this weekend?
Well, actually, I've been very happy about what went on. They did honor me, and I'm gave honor to God and thanks that I'm here. One of the things that was sort of depressing is that I looked at the in memoriam that they had in the book, and so many people that are acquaintances and friends of mine are no longer with us. So I give honor and thanks that I'm still on the right side of the grass.
Well,
But on another note, Dr. Walks, a gentleman in California who I happen to have sent your CV called me and says, man, I had no idea this gentleman had done all this stuff. He was so blown away by the accomplishments and CV of Dr. Walks. He just couldn't believe it. He couldn't believe it. So I was very gratified that he so honors you.
well, Dr. Maxey, you and I have both been toiling in the vineyard for more than a few days, and when you try to do your best, sometimes people notice, and that's a good thing. So we had a really good presentation, a taped presentation today that Dr. Burrows gave, and I wanted to make sure that you had a lot of time to get back um, to your opportunity for acknowledgement, Dr. Maxey.
Mhm.
We have in the chat just a note about the first one of the early slides that Dr. Burrows showed about Dick Clark and the American Bandstand show being hosted in Pennsylvania and in Philadelphia. And then the other comments, Dr. Maxey, were positive comments and congratulations for you. So we can call this Dr. Maxey Day on Black Health Trust because we really appreciate all that you do. Um, I don't see any other comments and any other hands raised. So I have a comment I'd like to make about Dr. Burrows' presentation because I think that the last part of the presentation was a lot about ways that our external efforts can make us feel better and healthier on the inside. And a couple of comments. One is that it's very difficult to spend a lot of time on the outside without having some doctor or some practitioner ask you about your health on the inside. So maybe there is a real clear link between caring about how you look and understanding the status of your health. And back to the earlier part of Dr. Burrows' presentation, it is absolutely critical that we know our numbers like blood pressure and cholesterol and A1C, but also that we know our numbers in terms of what we're supposed to ask our doctors for with respect to our screenings. A lot of information comes out, and if you're not paying attention, you might miss it. I heard today that they're beginning to find a link between the shingles vaccine and a reduction in some of the plaques that are associated with Alzheimer's disease. A lot more research needs to be done, but as you pay attention to what's happening in the medical community, particularly in medical research, there are a lot of links to paying attention, getting what we need, keeping ourselves healthy, and maybe there's some other benefits to it. So that's my comment on what we talked about today.
Let me have a comment, if I may, Dr. Walks.
Absolutely.
My approach here as a psychiatrist was to say, one thing I'm going sideways. I think her point about bringing the name of Suzanne Summers up has some legitimacy in terms of longevity and health. What do you think about some of the things or claims that Suzanne Summers was making? Not to the extreme, but
I think one of the most important things about that is that we are able to talk about sexual health and that we're able to talk about sexual pleasure. So many of the medications that doctors and other practitioners prescribe may impact sexual interest, libido, may impact sexual performance or the experience of sexual pleasure. And I was talking with a patient a couple of weeks ago who said, well, I was kind of embarrassed to bring this up, Dr. Walks. And I said, if you can't talk to your doctor about that area of your life experience, get another doctor, because we really do have to be able to talk about all of the things that make us feel energized and energetic and connected, either to our own pleasure or connected to someone else. So yeah, I think Suzanne Summers, whether she was able to do what she said or not, I think it's a great thing for us to talk about.
Great. And thank you a lot. And this has been a great day, Dr. Walks.
Dr. Maxey, I really can't say enough how important it is for folks to recognize that the work that folks like you do matters, and hopefully it will inspire a lot of other folks who are on the call today and who are watching on YouTube and who find our Black Health Trust programs in the archives, really inspire them to continue to push forward. So many times we feel like, oh, what I'm doing may not be making a difference, or nobody appreciates what I'm doing. And when you have an honor like the one you have received, it really can inspire the rest of us to keep pushing forward. So thanks, Dr. Maxey. Appreciate it, bruh.
Thank you, Dr. Walks.
All right, Simon, go ahead and take us out. I don't see any other comments other than some other congratulations for Dr. Maxey. Always happy to see those. Thanks everyone for joining us this afternoon, and we'll hope to see you again next week.
Thank you. Bye, everybody. Thank you, Simon.